experiencing symptoms such as bloating, gas, diarrhea, or abdominal cramps, a valuable diagnostic tool is the hydrogen breath test. This is an umbrella term for all hydrogen breath tests. In this video, we will address three. They are lactose, fructose, and small bowel bacterial overgrowth with lactulose. Although some preparation is required, the test is not complicated and can be easily done at home. These are the tools that you will be using for your hydrogen breath test. The first is a mouthpiece with attached bag that you will be blowing into for the test. These are the vials that will attach to this little needle inside of this container here as you breathe. And these are the labels that you will label each vial with. You will receive printed instructions from your healthcare team to guide you through the preparation process starting 4 weeks prior to the test. You will be required to fast for 12 hours before your test, and you should have nothing to eat or drink on the day of the test. You will be required to avoid brushing your teeth within 2 hours of the test and not to smoke within 1 hour before or at any point during the test. Additionally, do not sleep or exercise vigorously 1 hour before or during the test, as all of these will change test outcomes. Depending on the test that was ordered for you, you will receive one of 3 items with your test kit. If you were ordered a lactose test, you will receive a packet of lactose powder. If you were ordered a fructose test, you will receive a packet of fructose powder. If you were ordered a lactulose test, you will receive a packet of lactulose syrup. In each case, these are to be mixed in 8 ounces of water and drunk over a period of 1 to 2 minutes. This should be done immediately after getting your baseline breath. As mentioned previously, this is not a complicated test. When you're doing your test, you will have the mouthpiece with the attached bag in one hand and the vial in the other. Remember that the vial attaches to this needle in this container here during the test. When you take a breath, make sure that it is not a deep breath. This should be a nice, normal breath. Close your mouth around the mouthpiece and exhale normally. As you exhale, the bag fills with air. Keep it inflated. During your exhalation, insert the test tube into the needle holder completely so the stopper on the tube is punctured. Then, after 1 or 2 seconds, remove the tube and stop exhaling. After each breath, label the vial. Label them 1, 2, 3, and so on in the order in which you take the breaths. For each vial, make sure that you write down the date, time, your name, and the type of test that you had. If you're wondering about the SIBO on the label, that stands for small intestinal bacterial overgrowth. This is the box you would check if you were having a test done with lactulose. To prepare the item that you have been given to drink, open the packet and dilute it in 8 ounces of water. Take a straw and mix it together. The straw will also be useful when you drink the substance, as this will help it to bypass some of your taste buds. After you drink the substance, you will be required to take a breath at pre-specified intervals. Your test kit will come with instructions as to how often you should take breath samples. Some people will have to do them more often than others. After you take your last hydrogen breath test, label your final vial and put each vial into the bubble container. Put the collection tubes, along with the equipment and any paperwork that you might have, into the cardboard box that was provided to you in your test kit. Mail this back to the gastric lab immediately for analysis. If you have questions about your test, our staff and nurses are available Monday through Friday from 8 a.m. until 6 p.m. They can be reached at 206-583-6440.